Hi, my name is Lily Hayes, and I'm going to do medication administration through IV push. First, I would put hand hygiene, and I'd ask my patient their name and date of birth, which I see is hearing crackles, and 2/2/1962 is their birth date. I would verify this with their bracelet and the MAR and their chart. And then after that, I'm going to ask the patient if they have any allergies. Do you have any allergies? They say no, but I double verify with the MAR and their chart. And then after that, I'm going to look at their order form, and I can see here, as you can see, there's nothing on it. It says the order is administer Lasix 20 milligram IV push now. The vial available is Lasix 10 milligrams per milliliter. So that means we'll be giving the patient 2 milliliters of Lasix. So then after that, I'm going to put on my gloves. And while I'm doing this, I'm just going to ask the 5 rights of medication, verify the 5 rights of medication. So I know I have the right patient, which is crackles hearing. We have the right dose, which is 2 milliliters. We have the right medication, which is Lasix. It's the right time, 12:30, and right route, which is through IV, And then after that, I'm just gonna make sure the area is all prepped. I did hand hygiene, put gloves on, and we are going to check the IV site. And I see there's no irritation or inflammation, no signs of any infection or anything. And then I'll prep my area. And I'm going to double verify that what I have is Lasix, and it says also 40 milligrams per 4 milliliters. So I know I'm still giving 2 milliliters to the patient. And then first I'm going to take all the air bubbles out of my saline. And cap them. And then I'm going to, I know I'm doing 2 ml, so I'm going to put 2 ml of air on cap. Push air into the bottle. And pull up 2 ml. Get any air bubbles out. Perfect. And then I'll recap. As you can see, 2 ml of Lasix, and then lay that here. And then I want to then get a cotton swab or alcohol swab out and clean the IV for 10 seconds. 2, 3, 4, 5, 6, 7, 8, 9, 10. I'll let that air dry, and then I'll grab some saline. And unclamp and pull in, push in 2 to 3 ml, but first I'll push a little bit in and then pull back, and I'll see blood return, which means it's patent, and then put the rest of the 2 to 3 ml in. Twist. Recap. Get another new clean alcohol swab, and clean it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then I'll uncap the medication so the needle's not on it. And infuse the Lasix slowly over 1 to 2 minutes. Slowly infuse the Lasix. Ask the patient how they're feeling. Are you feeling okay? Feeling okay? Slowly infusing it. Start pushing it. Take it off. And then get another alcohol swab. A new one. And clean it for 10 seconds. 8, 9, 10. And you get the other saline and cap it. After that's air dried, I would then infuse 2 to 3 ml of normal saline. Take it off, and then if there was alcohol caps, I would put that on so it'd be sterile, and then I would reclamp it. And then I'd ask the patient again, how are you feeling? Are you feeling okay? Okay, good. And then I would put all of these into the sharp container and get rid of these properly. And I would document what I have done. And then I would take off my gloves, put them in the trash, and provide hand hygiene.